name is Edna Rose, and public health specialist, and today I'm going to talk about hepatitis B disease, which has become endemic in the country. Hepatitis B virus is always abbreviated as HBV, and it's one of the double-stranded DNA type species of genus Orthohepatinavirus, which is likewise a part of the Hepatinavirinae family of viruses. This virus causes the disease hepatitis B. Hepatitis B is a potentially life-threatening liver infection caused by HBV. In Uganda, the prevalence of hepatitis B is 10% in the general population. Regionally, Karamoja has the highest infection rates at 23.9%, Northern Uganda at 20%, West Nile at 18.5%, and Western region has the lowest at 10%. Hepatitis B is responsible for 80% of liver cancers in Mulago Hospital. Hepatitis B is more infectious than HIV and AIDS. It can survive out of the body for at least 7 days. And during this time, the virus can still cause infection if it enters the body. Incubation period of hepatitis B virus is 75 days on average, but can vary from 30 to 180 days. The virus may be detected within the first 30 days, 30 to 60 days after the infection, and can persist and develop into chronic hepatitis B disease. Hepatitis B infection causes significant global burden of disease, with approximately 2 billion people exposed to the virus and more than 350 million who are chronic carriers. It's a cause of more than 600,000 deaths annually, and Africa shares 25% of the HBV burden with 65 million chronic carriers. This infection is highly endemic in Uganda, and the national prevalence estimate is 10%. Hepatitis B can be transmitted through infected blood products, unprotected sex with infected people, infected items such as needles and razor blades, and also dental and medical equipment, unscreened blood transfusion, mother to child at birth, but it cannot be spread or transmitted through contaminated food or water. Hepatitis B is always asymptomatic, but the persons always get ill. Those who get the signs and symptoms always get ill in 30 days to 6 months after the exposure to the virus. But some of these signs and symptoms include fatigue, nausea, abdominal pain, dark urine, clay-colored stool, joint pain, loss of appetite, and fever, among others. But note that every time everyone gets these signs and symptoms, it doesn't necessarily mean you have hepatitis B virus, but it could be another disease. So get tested and know what exactly is going on. Hepatitis B leads to liver failure. This is a rare case, but in most cases, when liver failure occurs, that means death must occur. Liver cancer, we have liver cirrhosis and stigma due to no one will actually interact with someone who is having hepatitis B. So there's that kind of stigma. Then acute liver infections. Those are some of the effects. And on a good note, hepatitis B virus can be preventable. This can be through the HBV vaccination, which is going on in the country. We have proper use of condoms. You can't just trust anyone and have unprotected sex, so you have to use condoms properly. We have the ABC strategy, which is abstinence, being faithful to the partner, and using condoms. Do not share sharp and body piercing objects like razor blades and needles. Avoid piercings and tattoos, especially when you're in an area where there is this disease, or there is maybe where people are getting it a lot, like in Karamoja, Northern Uganda, Western Uganda, and everywhere. So always avoid these piercings. Use of gloves and jig by the health workers. These health workers always get in contact with so many people with different illnesses, so they should always use gloves and jig. Proper disposal of blood-soaked items and other hospital equipment, such as cotton soaked with blood, bandages, syringes, and needles used in hospitals, so to prevent this infection. Thank you so much.